Good morning, and thank you, Chairwoman Davis and the committee. My name is Heidi Schwartzwaldt. I'm a pediatrician. I've worked in the state of Texas for over 20 years, and I also serve as the Children's Chief Medical Officer for the Texas Children's Health Plan. This is the biggest community-based health plan in our state, covering over 400,000 lives of women and children in Medicaid and CHIP, including 26,000 of our Star Kids members who are children with disabilities. We are affiliated with Texas Children's Hospital and the 1,300 physicians who work within Texas Children's Hospital. We have 3 requests this morning for the committee. First, Texas Children's Health Plan strongly supports 12 months of continuous eligibility in the Medicaid program for the children in this program. The onerous process of having to do income verification makes it difficult for families to remain in care and fragments their care. Within the CHIP program, we already have 12 months of eligibility, and after the first 3 months, our CHIP members remain with their health plan. When patients come on and off of Medicaid, they lose access to their medications and to their providers. So if you have a patient with asthma or ADHD and they can't get their medications for a month, you run the risk of complications of their disease and of high cost utilization in emergency rooms and other places. We know that when patients and members stay with one health plan continuously, we can lower their per member per month costs more effectively. Secondly, we'd like to advocate for women of childbearing age to also...
I'm so sorry. May I interrupt just for a minute?
Absolutely.
On this subject of the 12 months. So right now in Texas, we require you to enroll every 6 months or re-enroll.
Yeah, we require you to do an income verification check.
And had we been on a 12-month schedule and then moved to 6 months?
It's always been at the 6 months. CHIP has 12 months.
Okay.
For Medicaid, it's always been this income check at 6 months, which requires families to, if they work for a small business, they have to try and get access to their records. They have to send them in. It's not easy for families to do that.
Do you think that there is a lesson to be learned from Harvey, being from Houston and having a community so impacted? I know that HHSC waived, waived a lot of things in response to Harvey. And so I'm wondering, could that not be, is there a lesson to be learned from that?
Thank you for that question. There is. So we saw that, so at the end of Harvey, eligibility was extended for several months after without needing the income eligibility check. And we saw that families remained in care and on care longer, and that gives us a much more opportunity to truly manage that care and to reduce their ER utilization. We did not, you rarely see families that their income has truly jumped high enough that they permanently stay off of Medicaid. They tend to roll off for a couple months and then come back on, which just drives disruptions in care. The other topic that we did want to address was a Medicaid for women of childbearing age. We know that one of the best ways to reduce morbidity and mortality in women of childbearing age during pregnancy and after pregnancy is by having access to high quality health care. We know that by allowing women to have access to plan and space their pregnancies, we can reduce cost and increase health of both the mom and the subsequent children. Healthy Texas Women does provide some family planning services and some behavioral health services, but we do believe that access to Medicaid and more comprehensive services could improve their health.
So for instance, if you were to allow mother to remain within the Medicaid program for a longer duration of time, let's say 12 months.
Absolutely.
Would you anticipate having better health outcomes, lower maternal mortality rates?
Absolutely. So as we know, many of the maternal mortality rates are based on hypertension, diabetes care, and then also substance use disorder. And to truly have 12 months of coverage afterwards allows women to continue in the care that they've had during their pregnancy to ensure reduction in these chronic illnesses, making them healthier for their subsequent pregnancies and making the subsequent children healthier.
Thank you.
Thank you. Lastly, as the Texas Children's Health Plan, we do believe in a fully integrated approach to services and populations for increased access and quality of care. Currently, we manage our behavioral health services ourselves. Those are not carved out. We handle our pharmacy benefits as well as the Medicaid benefits. We are concerned that carve-outs and opt-outs would fragment care and reduce our ability to provide that high-quality, more efficient care. Particularly carve-outs of STAR Kids or of the pharmacy benefits would decrease our ability to enhance that care. As an example, children who graduate from the NICU will frequently have something called chronic lung disease. The best management of chronic lung disease requires medications, it requires speech and occupational therapy, and it requires being able to see your provider. When we can provide all of that holistically, we're able to really drive down cost and improve the care and the life of that NICU child as they age. So I really do appreciate the time and attention, and I'm happy to answer any questions, and we're happy to answer questions now or throughout the session.
All right. Thank you very much
Thank
for your
you.
testimony. Greatly appreciate it.